Hi everyone, good evening. Who was here last night? Show of hands. Oh, wow, perfect. So I'm going to start with the game that was played last night. So who in this room thinks that gender matters when it comes to mental illness? And let me clarify that. That women have different symptoms than men, and that we potentially are treated differently when we seek psychiatric care. Who believes that's true? Who doesn't think that's true at all? That there's equality across the two. Okay. So my talk today is brief. They've given me 20 minutes to talk about why gender matters. And the reason why this is important is because the answer is yes, gender does matter. Being a woman matters. And we know from many, many, many years of research that not only do we exhibit distress differently than a man, we also report different symptoms when we see our friends, our family than a man does. And we're also treated differently when we seek care. And so, for example, depression. And depression seems to be the theme for the past couple of days during this conference. Both men and women can be depressed, absolutely. But women are 2 times more likely to be depressed than a man. Now, some people say that's because we're biologically different. We have different hormones, we just are different human beings, and that's absolutely true. But also what impacts is our role in our culture and our society that also impacts why sometimes we are 2 times more likely to be depressed. Who here is their primary caretaker of their children? So the hands that I see up are women. Women tend to be the central focus of a family, and that's true across many, many, many cultures. And we tend to take on most of the burden when it comes to taking care of our family. So not only are we different biologically, but our expectations of a woman are different, and that puts us at greater risk. Now, I do a lot of work overseas in Africa. And what I find so interesting when I'm in the United States, when I'm in Canada, when I'm in Kuwait, or when I'm in a rural area of Africa, all women are the same. We all struggle with the same stresses every day. And so some of the things that I have noticed and that has been well documented is that depression is very common when a woman is pregnant. And what we've been finding is that also women are very depressed after they deliver their babies. And what we're noticing in research is that women are self-blaming. They're saying, if I'm depressed and if I'm feeling this way, that means it's my fault. That means I'm a bad mom, and that I'm not going to be a good parent. And when I tell you, when I travel to all these places, and I'm in a rural area in an Ethiopian village, those women have the same concerns that I do in the United States, and that I'm sure you do here in Kuwait. That I shouldn't be depressed because I have this beautiful newborn baby, and that there's no reason for me to be depressed. And it's actually quite normal. And really, the limited time that I have here today is I really want to talk about that it's nothing to be ashamed about as women that we're struggling, that we have some anxiety, that we have stress, that sometimes we feel sad and we feel depressed, and that's actually completely normal. And it's very normal for women throughout their lifespan. And we see peaks of anxiety and mental illness during adolescence. So when a girl really is 12, 13 and going through puberty, we see a little peak. We also notice eating disorders as well around this time. And we'll leave that for Dr. Parekh, who will talk about child and adolescence. And then also when women, during pregnancy and after pregnancy, and we know that women who are depressed prior to getting pregnant are more likely to be depressed after delivering their baby. Now, what are the implications of that? So I just said this is normal. Women all over the world feel this way. The issue is getting women to seek help, because I think a lot of women feel ashamed and feel that I shouldn't feel like this, and I'm going to just keep this quiet. And here's the problem. We know that we are key to our families, and we know that if we're not feeling well, that has implications for us, our kids, and our family and our larger community. And so it's vitally important for us to seek help when we're not feeling well, because it has implications for the rest of the family members, including our children. And so the issue is, who do you go seek help? Do you need a psychiatrist? Do you need a psychologist? Do you need friends? Do you need family? And we know that social support is huge. And what I learned actually this week while being here is that when women have a baby, let me see if I get this right, for the first 40 days, they go to their mother's house.
Yes.
You guys are way ahead of the times, right? Because social support, we don't do that in the United States, right? We have a baby, we're in the hospital for 2 to 3 days, we get sent home, and then we're like, good luck, and we need to be back to work in 8 weeks, right? So I'd be interested in actually comparing the two cultures, because it's very different. And so when I learned about this, I thought, my goodness, they are way ahead. Because social support, being around your family, your friends, is hugely beneficial. But sometimes that's not enough. And sometimes no matter how much your family is supporting you and telling you it's going to be okay, it's sometimes not enough. And that's when it's okay to go seek help, to go see a psychologist, to go see a psychiatrist, to talk about these things. Because you're not alone. Lots of women feel like this. And then what we're noticing is that there's another peak during menopause. And we're noticing it's because that our hormones are changing during that time. And so now, we basically are going through our life cycle with different risk factors potentially. And so the idea is what I've been finding is a lot of stigma around women especially. And I think it's because we take on such a burden on taking care of our families and our children, and we kind of forget to take care of ourselves. And that's across all cultures. And so it's important to know that this is normal. This is not abnormal. Now, I've spoken about depression and anxiety, very common, but women are at risk for other illnesses as well. Schizophrenia, for example, is I'd say this, in the United States is the same risk for men and women. I don't have any data in Kuwait, so I'm not sure. But even in an illness like schizophrenia, what we call that a brain disorder, there are differences. Women actually get sicker later. Women get sicker in their mid to late 20s, where men get sick probably in their late teens, early 20s. Women actually do much better with schizophrenia, and they say that's because of the later onset of the illness, that we tend to have had a family around us, that we have put a social system around us, that we've been able to be kind of protected a little bit before the onset of the illness. But we see gender differences in even things like schizophrenia as well. And so when I'm traveling to all these countries and I'm noticing how wrong I think the United States does it actually, is I find that all these different cultures have a built-in support system. It naturally is part of your culture, that the family comes together and really, really helps each other out. And we've studied this for years, and we've come to the conclusion that that's actually quite useful. But what I'm finding is the stigma that's really attached to it. So there's this built-in self-support system, but there's so much stigma on women to seek help that we sometimes don't utilize that system that's already there. In the United States, we don't really have a social support system. I'm very lucky. I come from a Portuguese family, and I find these similarities between cultures. I have a very big, loud family who also loves to eat all the time, and so I feel really at home here in Kuwait. because I've been eating for the past 7 days. And so I noticed these differences in the U.S. But I really believe that it's stigma that's driving these women to not talk about it and to self-blame. And if anything that can come across tonight is that it's not our fault. It's not our fault that sometimes we just don't feel good. That sometimes it's kind of hard to get out of bed in the morning. That sometimes I'm so fatigued that I just don't feel like cooking for my family today. That I'm not enjoying the things that I used to enjoy. That does not mean you are a bad parent. It does not mean that you're a bad person. We all go through this. And I go back to those rural women in Ethiopia. They have the same symptoms that we do in the United States, and that I'm sure women here in Kuwait do as well. And so the idea is as we're talking about reducing stigma, in my area, I probably should have given a little introduction to myself.
Yeah, a little bit.
Okay. So I'll do the introduction now. So I have a PhD in public health, and so I'm a social scientist, and my love is women's mental health, and hope to devote my career to this, and I'm really interested in how culture really impacts a woman's access to care and how a woman exhibits distress. And so when I'm talking to a woman in, let's say, Ethiopia or Liberia, and she's telling me that she's not feeling well, the way she describes it is very different than a woman in the United States, as I'm sure a woman here in Kuwait. And what I'm really interested in knowing is how do women express that they're not feeling good? Who here finds it easier to say that they had a headache versus that they feel sad? Can we tell our friends, oh, I had a really, really bad headache all day yesterday? We find that really easy. I'm one of these days I'm going to fall. Women find it very easy to talk about physical stuff. Oh, head really hurts today, my back hurts today. And the thing is what we don't realize as women is that sometimes our somatic complaints, our physical complaints, have a psychological basis to it. If you think about your most stressful days that you have, think about those days. The most stressful. Do you feel well physically? Probably not. You probably have a headache. Your stomach probably doesn't feel so good either. You don't have an appetite. Don't feel like eating. So it's important to also self-recognize that when you have these physical manifestations, that this could be an underlying problem that you've peaked on your stress. And that it is okay to go seek help for this. And it's okay to go see a primary care doctor. It is okay to go see a psychologist or a psychiatrist to talk about these things. We all go through it. How much time do I have? 5 minutes. Okay. They're running a very tight schedule on me today. Hello. So the reason why I think it's important to have these talks about why gender matters is because, back in the day, when we first started studying cardiovascular disease, heart disease, right? The United States was famous for this huge study. It was called the Framingham Heart Study. And what they did at the beginning is they studied all white men. For years, they studied all white men. And then they came out and said, these are the problems with heart disease, and this is how you're going to treat it. And it finally was women that said, oh, I don't think that that's how heart attacks are for us. But no research was done on it. And we know for heart disease that women actually don't have the same symptoms. We don't have that chest pain that men have. We have very different symptoms like shortness of breath and fatigue. So when you're talking about mental illness, and why I think it's so important that every time there's a conference like this, that we talk about gender, is because we're not the same as men, right? All the women in here are totally nodding in their heads, right? We are not the same as men. We're not the same biologically, and we're not the same socially. We express our feelings very differently. And so what that means is that my goal is to make sure that mental health care in every community is based on a woman's needs just as much as it's based on a man's needs. Because we have different needs. But it starts here. Because we can't develop the appropriate programs and the appropriate interventions if we can't start understanding how you're feeling on a regular basis. And how are you thinking about and feeling your stress and your anxieties that you have on a daily basis. So it's really important that we understand how you're feeling, so then on our end, we can develop the appropriate interventions and the appropriate treatments for all of you. But if I can leave with one summary, is this. When you're feeling at your worst, you're not alone. There are women all over this world, in these rural villages, who live in these teeny little huts, who feel the same way. Exactly the same way. And there's women in every country, in every community who feel the way you do. And so it's a normal process. And the key is to get you help and to get you assistance so that you can be the best person for your family, for yourselves, and for your children. Thank you.